This is the patient I was given. It'll be a quick review. The highlights are from the exam. The patient arrived on crutches with neck and bilateral arm pain. He has cervical radiculopathy type symptoms with positive Hoffman's, right Sperling signs, both positive, has diminished light touch and pinwheel sensation to his right C6-7 dermatome. He could easily have right finger extension weakness, very important to test. He has an antalgic gait and behaviors, flexion extension, pain at waist, pain catastrophizing, and he only uses Dilaudid for pain. Of concern with this patient is he has severe carpal tunnel syndrome bilaterally, and he also is getting some wrist extensor, which would be C6, and he's got some canal stenosis at C5-6. So it's not just the carpal tunnel that's causing his symptoms. Also, he has a lot of peppermint oil in his eyes. This could be used to mask drugs that are being taken, and it also causes insomnia. Come on in, Mr. Radar Sonar. How you doing today? Okay, come on in. Let's sit right here. What can I do for you today, Radar?
Oh, probably not a damn thing. The VA made me come.
So you said I can call you Radar. Radar, why are you here really, and where do you hurt?
Oh, I'm here for neck and arm pain, but my back's messed up a little bit. All I need is just some Dilaudid to take care of it.
Radar, I see you really got some guns there. It looks like you've really been hitting the weights. I know that helps you, for your strength. What do you do for your spiritual needs?
I used to believe in God, but I don't believe in that anymore, not after the war and whatnot.
Okay. Good. Well, all your cranial nerve checks look normal. You said your neck's sore. Tell me about your pain. Is it in your neck?
It's mainly in my neck, but I got it in my arms, especially down in the forearms. It's very painful.
Yeah, I couldn't see inside your head. I can't check that.
Not too funny.
Oh, sorry. You heel walk like this?
I ain't doing any damn test like that.
All right, sit down. Can you say toy boat fast 5 times?
Toy boat, toy boat, toy.
Can you say British Constitution 5 times fast?
British Constitution, fast.
Oh, sorry, that hurts. Can you make your fingers straight like that? Push back, extend them hard. That didn't hurt?
No, that's about the only thing that doesn't hurt.
Good. Okay, thank you. Very good. You're nice and strong there. How do you feel right here? Does that hurt at all?
Okay.
Oh, good. Okay. Okay, right there and right here.
I feel this one a little bit, but I can't feel anything on my right side. That feels the same. That feels the same as well.
Sore there?
Doesn't hurt.
Here?
Doesn't hurt.
Here?
Doesn't hurt.
Here? How about here?
Oh, that's real tender, especially on the right side there.
Okay. Okay, take your arm like this and put your hand on the head. Very nice. Now turn your thumb out like this. Does that hurt at all?
No.
Good. Radar, you haven't had any bowel or bladder problems, you said. And have you had any problems with sexual changes, any things like that?
Well, not that it's any of your business, but I've had a little bit of a change in bowel movement.
A little constipated?
Yes, constipated.
Okay. Oh, no soreness on all your back. Can you stand out of that chair without using your arms? Very good. Sit down here. Radar, why do you use crutches?
Oh, I had back surgery quite a while ago, and I just don't want to fall again.
Well, why would you think you would fall? You seem fit to me.
Oh, what do you care about that?
Go. Now back on your heels. Now walk on the inside of your feet. Come back on the outside. Very good. Super strong. Lift that big toe up real hard. Lift this one. Good. Okay, tell me when this stroke.
Oh, no, I can't do that. I had surgery in that knee.
Oh, okay. Do you feel this?
Yeah, it vibrates.
Oh, okay. Do you feel that here?
Can't feel it.
Don't feel it? How about here?
Can't feel it.
Hmm?
I had surgery on that foot back in '72.
Oh, okay. Radar, all your joint checks are pretty much normal. You seem pretty strong and everything. What do you squat in the wrestling room?
Oh, probably about 200 pounds.
200 pounds, huh? Geez, that's good. Why are you using crutches?
Yeah, I really don't need them.
Okay, that looks good, good. Okay, can you stand up? Put your feet together, close your eyes. Good. Okay, now get a normal stance. Now put your arms up to your side with your eyes closed. I want you to touch your nose with your right finger. Touch your nose with your right finger. Good. Okay? Okay, I want you to touch your nose and touch my finger. Fast you can. 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 I'm just going to flip. Oh. Okay, good. Radar, you seem strong. You've got some weakness up here. What's keeping you from getting out and wanting to get out in society?
Well, there's not much really keeping me from getting out. It's just this arm pain, especially this ride. I dropped things. It's just been terrible.
What would you agree to a plan if there was something I could do to help you?
Yeah, I might do that.
Radar, I think the start of the plan would be you need to see an orthopedic surgeon, and he can fix the carpal tunnel syndrome very easily. It's an outpatient surgery. Would you be interested in going to see him to help yourself?
Yeah, I'd probably do that, yes.
I think that would be great. When you're done with getting your carpal tunnel fixed, you've still got some narrowing in your neck, and it's compressing your spinal cord. I need to get a scan of your neck to see what's going on with that, to see if we can treat you. How do you feel about that?
I don't know. I'll do the carpal tunnel bit. I just can't do. It's too much trouble too much to think about right now.
Okay. Radar, I'm concerned the amount of narcotic you're on. It's causing you some constipation, but there's other things involved with it. You're kind of addicted to it, I think, and that you feel like you need it to survive. How do you feel about that?
I depend on it a little more than I should.
There's other things we can use. Well, Radar, the appointment's about to end. You probably know, but first off, I just want to thank you for your service to our country.
Thank you.
And it's really important that we're honest with each other so that we can help each other. And let's try and get you off the medication, get you with less pain.
Sure.
I was starting with this patient. It would seem that the symptoms that were bothering him the most would be his neck, and that's where I would start. The radiculopathy would need to be taken care of first. We'd need to start by mainly doing his carpal tunnel syndrome, refer him to the orthopod, get an MRI of his neck, and then see how he does with that. The fact this patient has normal muscle strength and reflexes to the upper and lower extremities tells me, though, that he does have some good range of motion and strength. Most of his pain could be coming just from the myelopathy in his neck. If this was not true and he had pain all over, he would need a more systemic workup that would be diseases like fibromyalgia. Further imaging and laboratory tests would have to include workup for thyroid, Maurice-Charcot-Tooth syndrome, probably myxedema, things like that. We need to do regular CBC electrolytes, monitor trigger points, and get an MRI, certainly of the cervical spine. Without actually seeing this patient in the office, this was an extremely difficult patient on paper. It was hard to judge whether he could have drug-seeking behavior because he did have good muscle strength, but at the same time he has pain all over, so it was very difficult to judge what was going on with him. If this patient went like I dreamed it would on this presentation, we would start PT, we'd have the MRI, we'd get his carpal tunnel fixed, maybe do a couple injections on his neck, and he'd be fine. But like I said, this is probably a dream. He did have some drug-seeking behavior, and it would just be tough to see what would happen here. Depending what went on with this patient in Plan A, we could end up needing an ortho referral for a carpal tunnel, knee, shoulder OA, psychiatry and addiction referral, neurosurgery referral, even cervical injections before that. He could have myofascial pain syndrome, fibromyalgia, any other systemic diseases, PTSD, Agent Orange, insomnia, even peppermint overdose, and he'd need to be assessed with Waddell's signs. And then I'd also get an MRI of the lumbar spine. If the patient did not improve, we'd have to look at the electric shocks going down his arms as the main things. If the carpal tunnel didn't take care of it, it'd be important to build provider-patient bond, really assess his OA and especially his knee pain. And as I said, this would be a complex, difficult, time-consuming exam on this patient.
Yes, I
You
did.
feel that?
Yes, I do. No, I feel that.
I want you to stand up, and I want you to put your feet together and close your. No, you gotta wait.
Yes!
Best you can. Now I want you to go. Best you can. Okay, that's good. It's just a check for upper motor neuron disease. I'm just better if I could come up with something.
Yes.
Or is there would you be interested in a plan that would make you feel better? Would you try to agree to a plan? Maybe? All right, well, here, try this. Outpatient surgery, you probably don't want to do two at once because there's technical difficulties because you have a cast on each arm, especially with that constipation.
I think I'd rather just take care of the carpal tunnel first. I mean, it's just so much to think about.
Well, good. It was a good appointment. I think we got a pretty good plan. Do you have any questions about it, or?
No, I don't know.
All right. Well, it was really nice to meet you. Let me get your crutches for you.
I'll get those.